According to the National Stroke Association, this month alone, about 65,000 Americans will experience a stroke. May is National Stroke Awareness Month, a time when Americans are encouraged to learn to identify a stroke and take steps to lower their risk of having a stroke. Mercy Hospital has been working hard to get patients who do have strokes back to their regular life as often as possible. They have started doing a procedure that is helping those who experience the worst strokes. Danica has the story.
The emergency department at Mercy Hospital sees about 50 stroke cases a month.
Anyone can have strokes. Teenagers and pediatric patients all the way up until people over 100 years of age. It's a little more common in people that are older, but there's certainly people in their 20s and 30s that we see with strokes, even teenagers.
Nationwide, about 800,000 strokes are seen a year. And while anyone can have a stroke, risk factors that make a stroke more likely include high blood pressure, high cholesterol, a sedentary lifestyle, smoking, family history of stroke, and obesity.
Worldwide, it's still one of the leading causes of death, not so much in the United States, but across the globe, it's still a major issue.
Most often, strokes include some facial drooping, arm weakness, and loss of speech, but that's not always the case.
Some people can present with very mild symptoms or no symptoms whatsoever. We frequently find strokes doing a scan for a trauma or other reasons when we find that there's been an old stroke. Or they can be more classic, the people with loss of speech or one side of their body that's weak. So it can be all over the map. The ones that are most symptomatic are the ones we want to catch obviously the fastest and treat the most quickly.
It's best to be seen in an emergency room within 3 hours of the onset of stroke symptoms. During that time window, doctors are often able to help.
Up until this point in time, our treatment for stroke was prevention, which is still the best, but in individuals that did have a stroke or a blood vessel that was occluded, we would give medicines through the IV that were very high risk and were intended to dissolve blood clots, hoping to open up some trickle of blood beyond an occluded artery to help perfuse that brain that was starving for oxygen.
Now doctors at Mercy Hospital are using a new treatment to help even more. Their new procedure is called a mechanical thrombectomy. They started performing it in August.
What this is it's a mechanical procedure, so physically going in through an artery in the groin, threading a wire up the extent of the body up into the brain, and removing pieces of that clot manually.
Serious strokes can lead to loss of body control, loss of independent living, and more. This procedure is allowing some people with the worst strokes to have only minor, if any, lasting effects.
We've had individuals come in with complete loss of speech, complete inability to use one side of the body or the other, that after the procedure have regained almost complete independence, walking, talking, eating, and just enjoying life in general.
But it's not a procedure for everyone. Their blood clots have to be large, and they have to get to the hospital quickly, and their strokes have to be severe enough for doctors to recommend this.
It's not a miracle cure, and stroke is a very bad disease with a very imperfect treatment, but it gets us a little closer to helping get people back home as much as we can.
In their 48 procedures and counting they've done in the first 10 months, they've seen how this work is changing lives.
This has been a huge game changer for us, and it gives our patients a whole new level of care that they can expect when they come here, and so far the outcomes have been wonderful.
For North Metro TV News, Danica Peterson reporting.
Most importantly in stroke care is knowing how to recognize a stroke and seeking medical attention as quickly as possible if you suspect that you or someone you know is having a stroke.